Well, starting tomorrow, the new National Suicide Prevention Hotline is launching. 3 numbers, 988. That shortened number will make getting more help more accessible to people who are contemplating suicide.
Critical that when someone's in a state of crisis, that they have an outlet, that they have a resource that they can quickly call upon.
The organization that operates the Lifeline says that they soon plan to launch a pilot program for those in the LGBTQ community. And several organizations say people in that community have higher rates of depression and suicidal thoughts. And tonight, our in-depth reporter Anthony Hill is digging into those numbers and uncovers what is being done in our state to turn that trend around.
Meet Kiara, Sienna, and Adante. They're friends and a part of the LGBTQ plus community. They met up in Cypress Point Park in Tampa to have a candid conversation about how their life experiences have impacted their mental health.
I've always known I was different, and I like boys, but trying to figure that out and establish my own identity, but also having all that criticism and negativity of others bombarded.
My mom and my dad, that niche has always been very supportive and loving and very protective for the most part. But the outside of that, my parents, or their family, oh, absolutely not.
Growing up, my grandparents definitely on my dad's side were not feeling the whole gay thing. When I popped up with my girlfriend, they were like, "You have an evil spirit," is what my grandma had to say. They stopped talking to me for a while.
According to a recent report by the Human Rights Campaign Foundation, 59% of LGBTQ plus adults are battling with poor mental health. That's compared to about 8% of the general adult population. I wanted to find out why this disparity exists. So I went to speak with Lalencia Matthews. She's a psychiatric nurse practitioner. I asked her, what's contributing to that alarming statistic?
Because the societal norm is heterosexuality, it's not unusual for members of the LGBTQ plus community to be forced or learn to be forced to minimize their true selves or a part of themselves from the world.
Lalencia says many in the LGBTQ plus community don't have access to mental health care services. She says finding a therapist who understands you and your struggle is essential and recommends a website called Psychology Today, which uses filters such as gender, type of therapy, and price to find a therapist in your area.
And it also has that ability to say, hey, LGBTQ friendly, so that way it reduces the risk of being stigmatized by seeking out help.
I've dealt with anxiety and depression since I was a kid.
Another concern is the rate of depression and suicidal ideation among LGBTQ plus children. That same Human Rights Campaign Foundation report found that 54% of LGBTQ plus children are battling symptoms of depression. That's compared to just 29% of non-LGBTQ children.
LGBTQ young people are 4 times as likely as their heterosexual cisgender peers to attempt suicide before they graduate high school. That should alarm everyone.
Brendan Wolf is with Equality Florida, the state's largest LGBTQ plus advocacy group. They're trying to reverse the trend of poor mental health among LGBTQ plus children with their Safe and Healthy Schools program, which they launched in 2016. It serves 64 of the 67 school districts in Florida.
And so we launched our program that year to provide comprehensive training to administrators, educators, school board members, school officials, to help them understand not only how to create safe, healthy, and inclusive school environments, but also how to be in adherence with federal non-discrimination law.
Brendan says the passage of Florida's so-called Don't Say Gay bill could change that success rate. Supporters of the bill say it's meant to allow parents to determine if and when they want to talk to their children about LGBTQ plus topics. As for the 3 friends, they've gone through a lot in their lives, but they're optimistic that societal conditions will get better for those in the LGBTQ plus community, resulting in better mental health.
But just stay true to yourself and just know that you're wanted, you're valued, and you're loved.
And find your community.
Exactly. Your family might not be the family you were born with.
Exactly.
In Tampa, I'm in-depth reporter Anthony Hill, ABC Action News.